Hi, how was your day?
Oh, it wasn't good.
Oh, how come? Problem with the patients?
No, not exactly. The problem is balancing patient care with all the paperwork, rules, and requirements. I'm just going to take a nap for about an hour. I didn't sleep well last night. I've been having all these strange dreams.
You don't look happy. What's been troubling you?
I keep having the strangest dreams.
Tell me about them.
Well, in the one I remember the most, I've been abducted by aliens. In their spaceship, they are examining me with some amazing devices. And after a while, they start talking to each other very excitedly. And then one of the aliens tells me in English that I'm going home because Medicare won't cover their experimental procedure. So what do you think that all means?
Have you been watching a lot of science fiction movies? Have you been worried for some reason about experimental treatments?
Well, I just became involved in a clinical trial. I received a memo with a bunch of information on investigational devices that I haven't had a chance to read yet. Do you think that could be troubling me?
That could be a problem. I know I can help you. Let me summarize the investigational device issues.
Great. I could use a clear and concise summary.
Devices are categorized as either Category A, experimental investigational, or Category B, non-experimental investigational. Category B devices are covered in FDA-approved clinical trials, but you should contact the Medicare Administrative Contractor, or MAC, in advance. Under Category A, devices are not covered, but associated routine costs may be covered.
What's Medicare coverage like in a qualified clinical trial?
A trial is considered qualified if it evaluates an item or service that falls within the Medicare benefit, has a therapeutic intent, and enrolls patients with a diagnosed disease. In qualified trials, Medicare covers routine costs, costs related to complications, and any investigational items or services that Medicare covers outside of clinical trials.
What does the research sponsor pay for, and what does Medicare pay for?
Items or services unrelated to patient management or customarily provided by the research sponsor are not covered by Medicare. Medicare also doesn't cover costs related to trial eligibility or data collection and analysis. Keep in mind that if the patient has other insurance, including workers' comp, Medicare might not be the primary payer.
What about off-label uses? Are those covered?
Off-label uses are generally not covered without local MAC approval. The provider can cite drug compendia, medical literature, and standards of practice. For cancer drugs, the MAC can't deny coverage based solely on FDA labeling.
Okay, last question. What happens if the patient is injured in a non-qualifying trial?
Medicare might not pay for the services, so the provider should ask the sponsor to pay for these costs.
Well, this was very helpful. I just hope I can remember it all.
I know, it's a lot to remember, but sometimes the only thing you need to remember is to ask a question.
Thanks. I'll remember that. Well, the cardiologist and I discussed your aortic aneurysm, and he's concerned about the possibility of rupture. He thinks that you should consider an endovascular repair. Now, do you know what that is? Okay, well, a stent that covers your aneurysm is inserted by going through arteries in your arm or leg. Now, the physician performing the procedure will describe it in more detail, but I wanted to mention that because of your prior aortic arch repair, the type of stent being considered is investigational.
Will that be covered by my insurance?
Well, that's what I wanted to discuss with you. The stent is part of a clinical trial. Medicare pays for the device and related costs if notified in advance. If Medicare doesn't pay, the trial sponsor often will.
Are there other costs that Medicare won't cover?
Well, Medicare won't pay for the lab test that will determine if you're eligible for the trial. But again, the sponsor might. Do you have any other questions?
No, not for now. Thanks for taking the time to tell me about what Medicare will and won't cover.
Oh, well, it's my pleasure. In this practice, we believe that knowledge is power. I'm home!
Hey!
Ooh, something smells good.
You look like you're in a good mood.
Oh, I am.
How was your day?
It was wonderful. It was like a dream.